Hi, it's the Spinal Cord Injury Day special quiz. Here are a few questions related to the spinal cord, and all the answers for this goes alphabetically, so try and answer as much as you can. Which international scale grades motor and sensory impairment after a spinal cord injury? It's the Asia Impairment Scale. Which hemisection syndrome causes weakness and contralateral pain temperature loss? It's the Brown-Séquard syndrome. Which incomplete spinal cord injury causes disproportionately larger weakness in the arms than the legs? It's the central cord syndrome. Which venous thromboembolic event is common in acute spinal cord injury? Deep vein thrombosis. Which neuromodulation technique applies patterned currents in a dorsal epidural space to facilitate motor recovery? Epidural stimulation. Which posterior spinal joints are commonly disrupted in hyperextension injuries? It's the facet joints. Which anticonvulsant is commonly used for neuropathic pain after spinal cord injury? It's the gabapentin. Which mechanism of injury involves excessive backward bending of the spine? It's the hyperextension injury. What term describes loss of voluntary bladder and bowel control after spinal cord injury? The answer is incontinence. Which C1 burst fracture caused by axial loading is eponymously named? Jefferson fracture. Which deep tendon reflex is commonly exaggerated in upper motor neuron spinal lesions? Knee jerk reflex. Which spinal region principally controls lower limb function? The lumbar spine. What are the three protective membranes that surround the brain and the spinal cord? Meninges. Which cervical specialty primarily manages acute traumatic spinal cord injury? Neurosurgery. Which externally applied device is used to immobilize and support the injured spine? Orthosis. What is the name for tuberculosis of the spine causing vertebral collapse and gibbous deformity? That one I'm not going to tell you the answer, leave it in the comments. What is the term for paralysis of all four limbs due to high cervical spinal cord injury? Quadriplegia. What long-term multidisciplinary process is central to recovery after spinal cord injury? Rehabilitation. Which motor complication produces stiffness and involuntary contractions after spinal cord injury? Spasticity. Which spinal region lies between the cervical and the lumbar segments? Thoracic spine. Which infection is very common in spinal cord injury patients due to a neurogenic bladder? Urinary tract infection.